we all call them weekend warriors that want to be in CrossFit or they want to be exercising or playing sports into their 70s. And those people usually want to get back quickly too. And that's where I've developed this comprehensive 3-treatment approach that 90% of people are going to get better.
Welcome to the Fusionary Health Podcast. It's me, your host, Dr. Shivani Gupta, and I have a special guest in store for you. If you know me, you know I love finding the most incredible practitioners out there who are on the cutting edge of creating change and giving us the solutions we need for our health. So my favorite thing is to go out and find those practitioners, those doctors who are really using new toolkits and innovative toolkits in new ways. And so I'm so happy to welcome onto the podcast today, Dr. Sean Goddard. Welcome, Dr. Goddard.
Well, thanks, Dr. Shivani. Appreciate you having me on today.
So I've known Dr. Goddard for many years. I'd say at least 8 years now that I have been going to his office in Miami. He owns the Osteopathic Center, which is the most gorgeous IV clinic you've ever seen in your life. I've been going there for years for my IV vitamins. And every time I walk into his practice, the staff is so nice. They are so friendly. I always think to myself, I wish this decorator would do my house. This is incredible. And then I know since then, in these 8 years, you've really expanded. You have a Tennessee practice. You have a Jupiter practice. I believe you had a Jacksonville practice coming online as well. So will you share a little bit about your journey, what your focus is in your practice? Because we're going to talk about joint health in really innovative ways today. And then your locations so people can kind of understand what it is you do.
Yeah, definitely. So, my goal was always to move back to Tennessee. That's where I'm from. I'm not a big city person, but when I did go back up there, I realized the medical thought wasn't open to things that I do. And that was way back in 2009. And so Miami became my hub. Okay. And I ended up meeting somebody who owned a gym back then, Manning Sumner. And he had a really bad back problem, saved him from surgery, and he trained a lot of pro athletes. That got me into the professional athlete world and obviously other clients that he had too. And that kind of helped start build the foundation for what I have. And then it turned into Tennessee becoming a regular thing. I go there once a month. Then Jupiter opened, then Ponte Vedra Beach around Jacksonville opened. And we obviously do injections. We also do IV therapies for metabolic health, anti-aging, to prolong life, not just, length of life, but quality of life. And so I have a couple nurse practitioners. They run the Ponte Vedra and the Jacksonville office, and the Tennessee office. And then I go back and forth between the offices. And then we have a full-time doctor, a sports medicine doctor in Miami, Dr. Jesse Morris. And he's been with me 5 years this past August. Long time. And we both work together. We like to work as a team. If we have a case that we're like, I don't know, we run it by each other. And we want to get the best result for the patient. That's our goal. And I'm never going to pretend that I know everything. And I love, I trained in medicine. I trained in injections. I trained in manipulation. I trained in acupuncture. I like to take all those philosophies to come to a thought process on how to help somebody. And then I like to bring people in that have different experiences. Dr. Morse came from the MD traditional world, sports medicine fellowship, worked for a surgical practice. And now we're bringing on a anesthesia interventional spine doc that's starting with us 1 day a week next week. So we're really growing and bringing and broadening our knowledge so we can give people the best care possible in this space. My goal has always been to become like the Cleveland Clinic of integrative regenerative medicine. So people can see different practitioners and we can all work together to give people the best possible outcome.
Got it. It's so interesting. I remember I was in your office a couple months ago to say hi. Anytime I'm in Miami, I come by and say, hey guys, how's it going? Do you need any more turmeric from me or anything else? And you're one of the very few offices I actually visit now, because after owning my company for 10 years, I'm like, I don't have time for this job, but I have my favorites, my OG doctors. And I remember whenever I hang out with Dr. Morris, I'm like, yeah, this is my new problem. It's plantar fasciitis. That was my problem last year. And he goes, you should really consider, and I remember how he explained the injections, the plan. He's like, we're dealing with plantar fasciitis today. And so I'd love for you to talk a little bit about orthobiologics and some of these tools for joint pain that maybe we're not being offered in the traditional setting. Maybe we're being offered the typical, it's an NSAID, let's get you out of pain. Oh, that didn't work. Here's PT. Go do some stretching. Stay out of the gym and don't move, which is the worst answer, I think, on earth. And then the next one is, you want to avoid surgery for most of these things. And so then you just end up caught in the limbo and in pain. And my problem with that from most doctors is I need to stay working out in the gym, building muscle for longevity. Don't just tell me, we don't really have a solution for that. Would you like a steroid injection? Like that to me is not constructive. So will you kind of break down some of these orthobiologics that you work with that most people may not know about? I know about them because I'm into PRP and all these different things, but I'd love your take on some of the things you're doing and maybe some examples of how people can really stay in the game, whether it's the game of life, the game of the gym, or the game of their athletics.
Yeah, sure thing. Traditional medicine tries to pinpoint one source of the generation of your pain, and then that becomes the focus. Well, me training in manipulation and acupuncture and prolotherapy, the philosophy is different. The philosophy is that there's a bigger instability issue of a joint creating the arthritis or the tears happening. And if we don't address all of it, we're not going to get great long-term results. So the first breakdown with orthobiologics is understanding how the injections are done. There's 3 ways to do these injections. One's a joint injection. 2 is what I call spot injections, where you find, is that painful? Let's inject there. Or, okay, we see one injury, let's inject that one injury. And then there's the comprehensive way, which I even trademarked a procedure name for it because it's so rare to find. And I call it the prolograph procedure, but it's injecting all the stability structures around a joint and injecting the injuries and injecting the joint itself to get the best long-term results. And that's what I found with athletes in particular. And as you know, I love to use your product as a help to recover and heal with our injections. And I think one of the first people I used your product on was Rich Froning, and at the time he had a failed knee surgery, a failed meniscus surgery, and he kept having swelling. And so we did 3 procedures on him, and then we had him on your product, and he went back to competition after that. And so back then I was still developing my train of thought as to what's the best and most effective way to make these injections suitable for everybody. Sure. For athletes, I want to get them back as quickly as possible to doing what they love and sometimes what they need to do for money. And then I treat a lot of people, I call them we all call them weekend warriors that want to be in CrossFit or they want to be exercising or playing sports into their 70s. And those people usually want to get back quickly too. And that's where I've developed this comprehensive 3 treatment approach that 90% of people are going to get better, even with severe injuries. I had an NFL player years ago, and he had a complete PCL tear. He had a partial ACL and a severe partial MCL tear, and he didn't want surgery. And we did a few rounds of treatment on him, and he played without a PCL and with those big partial tears and didn't have a problem with that knee. So we don't always have to regrow a specific injury to get somebody functional again. And that's where the field is evolving to. Because, wouldn't everybody love to see a repeat MRI or ultrasound showing that something regrew completely? We do see it sometimes, but it doesn't always happen. So I really look and I think about how do we measure our healing process? And I call it the map to healing, the mobility, the activity, and the pain relief. If we can get those 3 things, we're going to have success with what we do. Then it comes down to what do we inject? And this is where it gets really complicated. Because you have a person's own blood products like PRP, platelet lysate, platelet releasate, you have platelet fibrin, A2M. Then you have what we call stem cell products, which aren't really stem cells, but the term got coined in the 90s and it's stuck. even though the researcher that coined the term, PhD Arnold Kaplan, in 2017 wrote another paper that said it's time to change the name. It's a medicinal signaling cell, because the cell does not become new tissue, and that's what a stem cell would do.
Sure.
This cell releases growth factors called exosomes, and it stimulates local tissue-specific stem cell to heal. So once we start understanding the mechanism better, we can understand what we're trying to do with our injections. So the stem cell products that everybody calls are taking somebody's own adipose tissue, which is fat tissue, taking bone marrow, or getting it from somebody else, getting the exosomes from MSCs. A lot of companies say they have exosomes, but they're not MSC exosomes, or it's just growth factors. And then there's tissue products, where we actually get pieces of tissue and inject it to an area which provides a scaffold for new tissue to grow on top of.
Okay.
So the key is understanding all these really in depth, in my opinion. And that's why for years I went to conference after conference to try to understand these things.
Yeah.
And now I feel like I have a really good grasp on it. And it helped. I was a biochemistry major. I worked in Oak Ridge National Lab. I worked in cell work at one of the big hospitals in Tennessee. So I had a good foundation to really start to understand how stem cell and platelet PRP therapy actually works. And then not only do we have to have the good products, then we have to have the right technique, because both of those together give us the best outcome.
Got it. I remember when we met, you talked about how you'd done a fellowship in this, and how there's a lot of people out there running around who are building IV clinics, or they're saying they do stem cell PRP just because a lot of people can do it, but that doesn't mean that they should be doing it. And so I just remember you saying, when we're talking about athletes here and pro athletes coming through, they're putting their career in our hands, and we're really working hard to get them healed and on the road again and back in the game. And I always thought it was so interesting, because the same person who's treating a pro athlete is the right person to treat us, because many of us are just as addicted, in a sense, to our workout, to our movement, to the things we need for our own happiness. And I think we underestimate a lot of times what it means to get out of the game. So, for example, I was in Italy probably 2 months ago now, and I chose to ride a Vespa. And I was like, I can do this. I'm a race car driver myself on I-95 express lanes. This will be great. It wasn't great. I underestimated. The guy was like, this bike is big and heavy, and you're only 5 feet tall. I think you underestimate what's going to happen here. And I was like, no, I've got it. I rode the bike, and boom, I fell the first time. I was like, no worries, I got this. Second time, I landed on my knee. And so I've been having knee pain, and I went to, medical massage, did what I thought was good for it, took turmeric, did those things. But now I'm starting to wake up in the morning and the knee is sticky. And so when I go to lift, I'm not going to do a back squat as heavy as I used to. I can tell how I'm starting to change how I work out and lift. And so what I hear you saying is, look, there's a lot of tools out there that are non-surgical, that are available to give us back the healing we need. And it might not be as simple as just inject the joint. There's actually more to it that you've explored and built as part of your processes to really, maybe we're not going to regrow cartilage in arthritis always, but we can actually build stability. I love how you said tissue scaffolding. I was like, that's interesting. How can we rebuild structure support so we gain function over time, and we can stay as active as we want to into our 50s, 60s, 70s, and beyond? And so where else have you seen that to be useful? Because the listener might be like, well, I don't know if that applies to me. And I'm automatically thinking like plantar fasciitis, knee pain, hip pain, back pain. Like people, because I'm in the turmeric world, people have come to me for a decade and told me their pain. And it's like my elbow, my shoulder. I mean, so will you talk into that a little bit so people can understand?
Yeah, there's no limit to when and where we can inject these products. Like I've injected 3 people over 90 years old just because they wanted to be functional within their environment. Yeah. And it worked. They were. All of them have had success with what we've done. But plantar fasciitis, I have a lady, she couldn't walk, and we were able to help her plantar fascia. And then we end up moving. We basically over 10 years now, we've injected her entire body, and she's doing fantastic. Wonderful. Going into the technique of it is tough because, there's a lot of, I call them pop-up clinics, whether it be pop-up IV clinics or pop-up stem cell clinics. And, it struck me one time. I have malpractice insurance that covers everything we do, which is kind of rare. But I talked to them and they go, well, for them to cover you for stem cell and PRP, we need you to do this course. And I looked at it. It was a 2-day course. I was like, well, let me tell you about the courses I did. I did a year-long course that I had to listen to over 100 lectures from PhD scientists in the field, from clinicians, and go do hands-on stem cell coursework. And then I did other stem cell coursework. So that one was with A4M, their stem cell fellowship. I also did work with AASCP. I'm a fellow of that group. That's the American Academy of Stem Cell Physicians. And they really give the philosophical guidance on what stem cells are. Well, not just philosophical, scientific guidance, because you got PhDs who studied this for decades, giving us information on what they know. But then there's a technique-driven science, which comes out of prolotherapy. And a lot of people haven't heard of it, but the first prolotherapy organization started over about 100 years ago for hernias. The first publication was 1937 in the JAMA journal for TMJ. And then books were written on in the 1950s. And then I was trained by docs that did these injections from the 1970s onward. And they were helping and fixing people with chemicals alone, because it would create an inflammation response wherever they injected it. And then that person would be able to be functional again. So that I was lucky enough to be around those docs and then get into the biologics, because my understanding of how these injections work is way different than most people. And that's what can help propel us forward. And so lately I talked at 3 conferences recently, and now it's showing the cases and what we can do and trying to get this idea and this philosophy of how to do it properly in the right way. So I had a patient. She came in a wheelchair because she had stabbing pain in her calf, and she couldn't walk at all. 10 out of 10 pain. And it was so severe, I told her, you know what, go to the ER, go to the orthopedic first. And it came down to, okay, you need 3-level fusion. And she told the doc, you know what, I think I'm going to try stem cell therapy. And he looked at her and goes, you have more money to waste than I do. Now, in fairness to him, he's probably used to people coming in that tried stem cell.
Sure.
Well, fast forward this story, I ended up fixing her, and she decided to go back to him and tell him.
Sure.
And she did. And he just turned around and walked out of the room, didn't even say a word to her. And she's better 7 years later. She had a very severe stenosis and herniation, but she still has that herniation, but we were able to calm that nerve down and release tissue around it so it wasn't compressed anymore. And we're able to get her functional. Did we fix something? No, we didn't fix that issue, but we made her functional again. And in fairness to a lot of docs, they do see a lot of people come from these pop-up clinics and they don't get people better. And that's why they're so negative. Sure. And if we can start getting a better training on how to do these injections, we're going to get more consistent results. And then we use it as a society, and we're going to keep a lot of people out of surgery.
Right. Which is a big deal. I'm pretty anti-surgery. What is the natural path forward? And it's so interesting, the point that you're highlighting, which is you might not see on MRI that perfect thing that you had before, that perfect, spine, that perfect cartilage, everything that was there before. But if we can support you in having structure and function, that's a big deal. Earlier, you mentioned Rich Froning, and I bet 90% of the people listening have no idea who that is. Around the time that you shipped Rich Froning my product, I was a CrossFitter. So post kids, I was like, I need to lose weight. I need to build muscle. A friend of mine owned a CrossFit, so they encouraged me to come. I joined. I probably should have built a lot more strength before I started doing those heavy overhead lifts. So I ended up leaving it because I was like, I don't think I'm built for this type of workout with my structure, my frame. But I remember seeing the name being like, I know who this is. So will you share with the audience who that is and how you put them on Fusionary? Because I think that's so exciting.
Yeah, at the time, Rich Froning had won 4 championships in a row of CrossFit, which was, unprecedented. And since then, there's been some other people. But, then he went into team competition. He had some knee surgeries and that the surgery didn't go well. So we had to help it out with the injections, and we did. And, but my philosophy is, okay, we need something to help heal the body. So, all the NSAIDs that are out there, the chemicals, they are super potent and they're blocking inflammatory pathways. Obviously, the science of turmeric more than I do, but, I've come to understand that it promotes healing, and it helps to decrease inflammation through other pathways, which can help the body to heal better. And not just for injuries, but for the whole body. And so, we use it in almost everybody that's willing to go on the supplement. And, in his case, he's just a different specimen. And I found high level athletes they tend to heal better than anybody. But things like this help the process along. And using fusionary formulas is really, I've seen a great response from our patients and how they recover from our injections.
I love working with orthopedics. I love working with osteopaths. You're an osteopathic physician. Osteopaths get it. Every osteopathic doctor I've met in the last decade, and it's only a handful, is always like, yeah, it's the whole body. Everything's connected. Of course, turmeric is a powerful support. Turmeric's a systemic support to the system. We need the entire system to heal and support what we're about to do to the body. So I always love working with practitioners like you, because you automatically get it. And the viewpoint is whole body, not just, it's just your elbow. Let's just inject the elbow and you'll be fine. It's where else is there instability that you may have used the elbow wrong. And thus we need to make a different approach to how we're going to support your healing. Because again, for example, it's my knee in this moment. It's always something with me. Sometimes it's plantar fasciitis. But the bigger question is, why are you generating the issue? And then how is that issue keeping you from living your life, your best life, your healthiest life? And I remember, whenever I get to come down to Miami, I usually come like twice a year and see you. I always ask you, like, what are some special patient stories? Like, what have you seen work? And I always learn so much from you. And then I go and apply that to others. So I have had people come to me who have really weird health issues. And I'll say, you know what? Dr. Goddard would say IV vitamins could help with that. And then I'm up in Boca Raton, Florida, so not always down in Miami. I'll take them myself. We'll get IV vitamins. Sometimes if I can't drive the hour down, I will find a place that I can secondarily sort of trust with IV vitamins. I'm hesitant though. And they'll get fixed completely. The issue will resolve. And so I love that you're always pushing for, I see you have a complex issue. I see you're kind of at the end of your road, not finding a solution with all the doctors you've gone to. I have some ideas. Let's see what we can try here and let's see how it works. So do you have some other stories around, athletes or people who you've worked with where they were kind of at the end of their rope, and all of a sudden, because you were able to bring in your team and the way you approach this more regenerative approach to joint health, you were able to help them or on the IV side as well?
Well, I'll start with my story. About over 5 years ago, I had appendicitis. Okay. And I went to the hospital and it was diagnosed via CT scan. And of course, surgeon wanted to do surgery. Yeah. But it wasn't burst. If it would have burst, I would have had surgery, but it didn't. So I decided to stay in the hospital, do the IV antibiotics. And I had 8 surgeons over 3 days tell me I was crazy. And I'm going to die. If I get better, then I'm going to be back in 6 months. And I did get better. My white count went down, my fever went down, and my pain went down. And I immediately went to my office and I did IVs every single day for 30 days, as well as supplements. And it's been, like I said, over 5 years, and I still have my appendix and I don't have pain. I don't have problems. So that thinking came from those docs that I told you about working in the 1970s. They were doing IVs since then as well. And I just was lucky enough to see the extreme things get reversed with these doctors. And it gave me the belief that it could happen. The only thing holding us up is, okay, can people come in often enough? Unfortunately, this is cash based. So can people afford it? But if they can, I'm convinced most things we can help, because the IVs are helping mitochondrial stimulation. We do all the ozone therapies. We do the NAD, the methylene blue. Then we add peptide mitochondrial stuff. Then we detox, and we're very aggressive. We do the chelation detoxing. And then also ozone helps to detox NAD, glutathione, NAC. Reducing inflammation. Ozone and ultraviolet are great about that. Procaine's really good about that. High dose vitamin C is really good for that. We have so many tools that we can use in order to help people. I think one of the most extreme ones was a lady that for 25 years had what was diagnosed as a rheumatoid condition, pain in her whole body, took biologics. After one didn't work, they would go to a second one, go to another one. And finally, none of them worked. And the problem when you hit the end of the road in medicine, if they've run out of answers, they don't have a place for you. And they just basically say, okay, go home and be in pain and be in bed the rest of your life. Or I'll come back to this story, but yesterday I saw a patient. He's been through 9 back surgeries, and now he has nerve degeneration and atrophy of his quad. And it started because of a different surgery. And the problem is now the surgeons have given up at this point. They have no idea what to do. And it's just sad to me. If we could have done something at the beginning, we would have been most likely been able to help. I'm not going to say we're perfect. I don't want to give that impression, because if anybody says they can get 100% success, then I wouldn't go to them. Yeah. And we've heard that overseas a lot. And so anyway, I digress. But going back to the lady with autoimmune, when she came to us, she was on 11 medicines and still had severe pain and severe fatigue. And we ended up she decided, you know what, I'm going to get healthy and I believe in what you do. So she flew to Miami and she stayed with us for 4 months. And we did IVs every single day. And slowly we were able to start weaning her off some of her medicines. And then by the end, she was off of all of her medicines. And then she went back home, and now she's still doing really well. But how many people can take the time, can take the effort to do that? That's why one day we're hoping that, insurances can come around. We have had some of the faith-based insurances. They have a different kind of approval process, but some of those have covered our services. We write a note as to what the patient is experiencing, what our plan would be. And They have covered things like ozone therapy and chelation therapy and even stem cell and PRP therapy. Nice. So, I'm encouraging people to maybe move over to those type of insurances if you want this type of healthcare.
Hi, I'm Dr. Shivani Gupta, and I created Fusionary Formulas because I believe everyone deserves a natural way to support their body's health. If you struggle with joint discomfort or stiffness, our turmeric gold delivers powerful curcumin in a form your body can truly absorb. It's science-backed with the highest quality ingredients and designed to support your body's natural inflammatory response. Take the next step in your health and wellness journey today. Visit fusionaryformulas.com and use code FusionaryHealth for 15% off. Fusionary Formulas, ancient wisdom, modern science, maximum impact. It's interesting, your point about end of the road. A lot of times when I meet people, they are already at the end of the road because they've already seen traditional Western medicine. They've actually gone through different integrative practitioners. Maybe it's naturopathic, maybe it's acupuncture, chiropractic, down to medical massage, Reiki. Usually your last door you ever find in your life is Ayurveda. And so I have ended up in the last decade meeting so many people like that. And the greatest gift I have is actually knowing practitioners like you, because I can say, you know what? I think I know someone and I think you should go to them because my intuition says it's Goddard this time, or it's this doctor this time, because oftentimes people get no answer at all. And I have been inside of detox centers where I've lived there for 3 weeks to detox myself and my mother for her health because she's diabetic. And I'm surrounded by people who have fibromyalgia, autoimmune, cancer, really bad stuff. And they're there because they literally could get no answer where they lived. And so part of me, as you were speaking, I was like, well, I'm in a year of mold. That's my health journey of 2025. I get to deal with mycotoxins. I get to rip this house to shreds and remediate it for past leaks. And I am spending more on my health in this 3-month period than I ever thought I could. But I am required to. Like, I either get to spend it now and get my health back online the way I need it to be, or I don't know what the punishment would be, but it's unacceptable to me to not be healthy. And so I find oftentimes we have to start making these really tough decisions in life. I was like, okay, well, Christmas is going to look different this year, and we're going to stop buying a lot of things. But what we're going to do is we're going to finish the mold and fix my health, and then the family's health and the kids' health. So I can just imagine sometimes people have hit the end of the road, and yes, these services are cash pay, but I'm just grateful they're available because we need the solutions. The alternative is bedridden or sick or losing function, or in my case, brain health, and all the things that I want to have at optimal levels. So when you were speaking about pain, because, you know, a lot of what you guys do is really special work around joint health. When a patient comes to you and says, I'm in pain, I want to avoid surgery, I want a solution, how long does it typically take to get them from, like, I have been in pain for X many years and I'm losing more and more function, to, okay, I can now go back to my pickleball game or lifting or whatever it is they want to do? What does that timeline look like?
So the first thing I need to do is figure out severity. And I want to know from an imaging standpoint, whether it be ultrasound, MRI, we like both, and even X-ray with it. I want to know, is it mild, moderate, severe condition we're dealing with? And then I want to know how the patient feels their condition is. Is it mild, moderate, severe in their own mind?
Sure.
Because sometimes imaging isn't perfect. And people think MRIs are the godsend, but they have slices. And if the protocol's not done properly, they will miss things. And then we have to have the physical exam to see how bad the joint is or the tissue is. And I use that information and alignment from my background as a body worker to understand, okay, how severe of a case are we really dealing with? Because if we're dealing with a severe imaging case, a severe interpretation from the patient, if they call it severe, then we're going to be in for a longer haul. It's going to be a 12 to 16 month recovery. And we need to be more aggressive. We need to do more stem cell therapy than we would with PRP therapy. But let's say, nowadays we are getting some people that come in a little earlier, like you. Yeah. We tend to get people at the end of the road. And I usually do 3 procedures. And the first one's a stem cell mixed with PRP. Then we followed up with 2 PRPs. And, the way the injections work, the mechanism is it induces the acute inflammatory response. And that only lasts for 2 weeks. Okay. And when it goes down, the body goes into a tissue remodeling phase. And that tissue remodeling can last for 1 to 2 years. And so in some cases, we tell everybody 3 to 6 months is a very typical time frame to think about your healing. But there are cases that have taken 12 months. And then there's cases that in a couple weeks, people are better. And the pro athletes tend to be the people that can go back immediately. Wow. And I think their tissue regeneration is just on a different level. But in general, though, usually we're seeing arthritis cases, osteoarthritis, which is degeneration of the cartilage. It also tells me that there's instability of the joint. And that tells me we need to strengthen the ligaments, the capsule, the connective tissue, get the joint healthy. Because what happens with osteoarthritis is you release these chemicals and they facilitate cartilage destruction. And there's been studies that show just doing an arthroscopic lavage, which means they wash the joint out, that helps as well. Mm-hmm. Well, okay, so we just need to reset the chemical balance. So when we do injections with PRP or stem cell, we can help stop that chemical cycle. And then we get into tendons and other things. So if we can get an idea, do we have lots of injuries? Do we have the arthritis with a tendon injury, with a ligament injury? Well, then our recovery is going to be a lot longer.
Sure.
And it just comes down to a detailed physical exam and doing the imaging. And we tend to get a lot of people that have had injections of some sort already, and they didn't work. And they didn't work because the docs didn't do it well enough. And sometimes a lot of people don't even have MRIs, and it blows my mind. If somebody's going to spend money on stem cell, I want to give them the best information and the best knowledge possible for that injury. So it's complex, and that's what I'm trying to build is a thought process of multiple doctors in a practice that can do the same replicable injections and treatments, and that's where we're headed. And of course, I'm kind of the spearhead of it, so I'm the one poking my nose in all the cases. But we've had some things like there's a case. Have you heard of Charcot-Marie tooth disease?
No.
It's a certain kind of disease that wears the nerves down. And as far as anybody knows, traditionally, there's no treatment for it. And it gets worse, and you have to have fusions, and you have to wear braces, and it particularly affects the foot and the ankle. Sorry. And so people end up having to wear braces. They have to have multiple surgeries. Well, we decided, this patient came in, and he wanted to try to stop this. And he had already had one surgery, but didn't want any more, but severe pain, couldn't walk very well. And me and my other doc, Dr. Morris, worked on this case, and we put our heads together and say, look, if we're going to do this, we're going to be very aggressive, and we're going to use the tissue graft that I talked about earlier. And he agreed to it, and we did it. And it's a year later now. He's playing golf 3 times a week, and he's okay. Well, that case in regular medicine shouldn't have happened. So these are the things we can affect, and we can change in people. And it just takes somebody to think a little outside the box, and also understanding the mechanism of these injections. That way we can get that. Another very extreme case was somebody where a dentist had hit a nerve in the mouth, the lingual nerve. And immediately he went numb, and he had trouble with moving his tongue as well. And he sounded like he was drunk.
Wow.
Because he couldn't talk. And so for 3 months, he went to all these specialists, and they all told him, we think it's permanent. You've had 24/7 pain for 3 months. Yeah. I'm sorry, but we think it's permanent. And there's 2 doctors that we would recommend to do surgery, and they're going to cut in there, reattach the lingual nerve, and wrap a stem cell, some kind of stem cell wrap around that nerve. And we're going to hope it works. We don't know.
Yeah.
And so he called me up. I go, well, why don't we just inject back here? And, for what we're going to do for this, I decided to use Exosomes. And I put a super high volume because I can't see the nerve back here with ultrasound.
Sure.
And within 6 weeks, he was completely back to normal.
Wow.
And it's like, why would we not try these things before going into something so invasive that can cause permanent injury?
Absolutely. I think as we're speaking, I'm like, well, I have scoliosis, I have knee pain. Somehow I lifted so heavy, I generated hip pain. I chronically have plantar fasciitis. So I'm just sitting here it always happens when I see a doctor, I always start like pressing all the parts that hurt. I'm like, oh my gosh, there's always something, right? I'm 45. So as I age, I generate these issues. But it's so fascinating to me that even I myself, who am in the turmeric world and a big part of the orthopedic world, and in the sense that I love meeting with orthos and saying, hey, there's a natural alternative to pain here. Please offer this to your patient. That's what I've said for 10 years. When we have these aches and pains, we underestimate how much it takes us out of activity. And we know activity is a big part of longevity. And so it's only logical for me. It kind of has to pile up. I'm in the pile up moment where I'm like, wait, now you got to go talk to a doctor and say, hey, we need to do some MRIs. Let's check what's going on. What's happening here? But I just wonder how often people will say, you know what, it's aging. This is aging. And I guess this is just how it is. And waking up, I'm going to feel stiff and all those things, as opposed to, let's go take some action. Let's go look for some options. Let's figure out how to get back to lifting just as heavy or moving or even traveling the way we want to. Like I wanted to climb Mount Kilimanjaro, and then I was like, well, I have bad feet. So can I do that? And I remember when I came to your office and I talked to Dr. Morris, I was like, I don't want the steroid injections in my feet. And I'm going to try this peptide and I think it'll work. And he's like, wait a minute. You could do a peptide or an exosome and you're choosing like the peptide. This thing is 50 times stronger. Like, do you understand what you're saying no to? And so will you kind of explain to our listener today that there's these different proportions of support you can give them? That's my understanding, is you can go for like level A, level B, or level C. And it takes a great practitioner to kind of discern where to start and then what to go to next. And then the second thing is, last time I talked to you a while back, you said, Shivani, the coolest thing just happened. I had a patient, I'll never forget the story. You said, I have a patient who has pain in their hands and they've been taking prescription NSAIDs for a decade. And they came off their prescription NSAID and they're taking your turmeric gold, your inflammation relief, and they're winning. And he's like, that to me is enough proof that this is a solution for my patients. And so I kind of live off of those stories of how do we get people out of pain? But where I think we are the perfect combo is, where is it the right treatment with the right post-treatment solution to give people back that quality of life they want, that movement, that flexibility, that strength that they want.
Yeah, you're completely right. And mixing together is the best thing. And going to your first question, it is about understanding, okay, what is the mechanism of an MSC, whether people call it mesenchymal stem cell or medicinal signaling cell, we call it an MSC, or an exosome, or PRP, or the peptides. And once we start to really get in depth with these, then we're going to have a better response for our patients. We've had a number of people go, you know what? I started doing the BPC and let's take your case, the plantar fascia is healed. And a year later, they're like, the BPC is not working anymore.
Right.
Now the pain's worse. Well, did the BPC heal it? Not really. It decreased your inflammation systemically to make you feel better, but it didn't fix it. Because why? Tendons, fascia, ligaments, joints have extremely poor blood supply. And so if we don't do direct injections, the likelihood of the body fixing it just by decreasing inflammation is very low.
Sure.
So we like to do direct injections of some kind of stem cell product or PRP, and then add peptides, add your product. And we're going to see better long-term results by combining it all together.
Got it. Makes total sense. Awesome. Well, this has been so great chatting with you and talking to you about this topic. I always love learning, and I know my listeners love learning about options and having options on the table and understanding when something's complex, maybe they've been given the answer of there's nothing else to do for you. Just go, roll your feet on ice water bottles and stretch more. That's an answer I get often. I'm like, really? That's your whole answer to me? I'm 45. I've got a lot more walking to do. That's not good enough for me. Then at least they have access to practitioners like you. And you're in 4 different cities, like Jacksonville, you've got Jupiter, Miami, you've got Tennessee. So I love that you're accessible in so many different places and building out these options for people to go out there and really get the health they need, get the help they need, the healthy joints they need, and the overall health that they need. So will you share, Dr. Goddard, where people can find you and any final thoughts that you have today?
Yep. No, and thank you very much for having me on. I've always enjoyed you coming in and talking. You always have a great energy. I'm all over the place, so I get stressed a bit with all the offices, but I do have that vision that I want this kind of healthcare for everybody. And that's why I put the time in, the effort, and a lot of people know it's not easy running businesses, especially in different states. And if we can build that level of knowledge within our base, then that's going to carry to other people. So, so our website is theosteocenter.com. We are starting another one called it's called ivsuite.com.
Nice.
And we're going to start doing what we call IV wellness memberships. It's not your typical, hey, pay $99 and we're going to do a vitamin IV. I want people that really want to be healthy, want longevity, that want to do prolongation of life and prevent disease. And so ours are a little more intense, but we're doing the intense treatments, the ozone treatments, the EBU, the 10-pass, the chelation, the stem cell IVs. So those are the two websites. Our Instagram, I have my personal one at KJS Goddard, and then the business one at the Osteo Center, and on TikTok as well.
Awesome. Wonderful. Everyone, I encourage you to follow Dr. Goddard. He is one of the very few, I have like a top 5 practitioners who I would let touch my body. And he is in that list of practitioners who is so conscientious, so well studied, always on that cutting edge. I know you're always going to the conferences, learning, sharing. Now you're teaching other physicians and practitioners your methodology and what you have found and your findings to work for your patients and your athletes. So I'm a super fan of Dr. Goddard's, if you cannot tell. And I encourage everyone to visit his website to learn more. And thank you for coming on the show today, Dr. Goddard.
Yeah, thanks so much for having me.
For sure. And for anyone who wants more info on this podcast, you can visit my website at drshivani.com, and I'm on Instagram at dr.shivanigupta. So I hope you guys enjoyed this episode. Please share it with a family member or a loved one who could use this kind of help in their lives. We're all here together to get healthier together. See you next week. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.